Hi everyone, my name is Yushen. Today we will do a video on 4 types of therapeutic exercise, including passive range of motion, stretching, joint mobilization, and resistance exercise. Now let's start it. First, I want to introduce what is hip extension. So the primary hip extensors are gluteus and hamstring. The muscle that limits hip extensions are rectus femoral and iliopsoas. For passive range of motion, we'll do a passive range of motion if a patient is unable to perform an active range of motion. Patient in a sideline position with knee bend, we want the patient to feel safe and fully relaxed. So get closer to them. And one hand under the knee, and the other one on their greater trochanters for stability. And then slowly move their leg. Do not force beyond available range. Repetitions are determined in the plan of care, usually 5 to 10 times. Stretching is to increase mobility of soft tissues and improve range of motion by elongating structures that have become shorted over time. Today we will do a static stretching, and the end field of hip extension is firm. Now let's start it. For hip extension stretching, we will stretch the hip flexor. Patient will slowly lying down and hold their knee at the same time. I will put my left hand on his right knee and my right hand on his left knee for stretching. We will hold it for 30 seconds each time and 3 reps per day. This is another hip extension stretching method. Have the patient kneel on their right knee and then line the right knee forward until a slight tension is felt in the left iliopsoas. So this is the intensity we want. Hold this position for 30 seconds and then switch leg and repeat this action 5 times a day. Resistance exercise can increase bone density and muscle strength. I use a pair of blue exercise band for adding resistance, and the training targets are gluteus and hamstring. Now we will do a resistance exercise for patients to practice at home. First, we will put the band under their knees, and the other side is under their foot, and we will let patient to kick back. Michael, can you kick back? Good. We want patient to do 10 reps for 3 sets and 3 times a week. Let's do a joint mobilization of hip extensor. Patient will stand beside the bed and then slowly lying down. And I put the mobilization belt through his leg. And I stand between his leg and maintain a good body mechanic. Then I put my one hand on his leg for stability, and the other one apply force in an anterior direction because this is a convex and concave joint. I find the greater trochanter and find the posterior aspect of the humeral head. I use oscillation technique. Start from grade 1 with small amplitude. As you see, my hand is barely moved right now. And then when we come to grade 2, the amplitude is getting larger. And both 1 and 2 are for pain control. When we come to grade 3, we really put pressure on patient to elongate the joint. And grade 4, the amplitude is small, but the intensity is high. The frequency of amplitude is 2 to 3 times per second. I will do it for 30 seconds and a total of 2 minutes and 3 times per week. And this joint mobilization will help them to increase their mobility. These are the exercises for hip extension today. I hope you enjoy them. Have a good day.